Welcome to the Clorox Healthcare Training Module for Patient Room Occupied Cleaning. Proper cleaning and disinfection of patient rooms is important to help prevent the spread of infections and is a critical part of keeping patients safe during their stay in your facility. The protocols in this video are based on current evidence-based practices and recommendations from the Centers for Disease Control and Prevention and the Association for the Healthcare Environment, but should be customized to meet the unique needs of your facility. This video will outline the process of cleaning an occupied patient room, including 8 key parts. 1. Prepare to enter. 2. Engage the patient. 3. Remove waste. 4. High dust. 5. Clean and disinfect. 6. Restock the patient room. 7. Clean the floor. And 8. Prepare to exit. Part 1. Prepare to enter. First, refer to your facility's supplies checklist and make sure your cart is stocked with the supplies you will need, which could include personal protective equipment or PPE, such as gloves and eye protection, dusting supplies, a broom and dustpan, cleaning cloths, hospital-grade EPA-registered disinfecting products, floor cleaning product, mop bucket, new mop heads and mop, toilet bowl mops, putty knife, wet floor signs, waste bags, clear and red, and linen hamper liners, specialty cleaners as needed, such as glass cleaner, paper products including toilet paper, paper towels, toilet seat covers, tint cards, hand hygiene refills, and an eye wash bottle. Next, park your EVS cart outside the patient room. Always keep your cart locked unless it is within eyesight. Perform hand hygiene per facility policy. Put on appropriate PPE. If there is an isolation precautions sign on the door, put on the PPE recommended by the sign in accordance with your facility's policy. If there is no isolation precautions sign, follow standard precautions, which includes gloves at a minimum. It's important for your safety and the safety of others to adhere to the precautions posted on the sign and always follow them during the entire room cleaning. Part 2. Engage the patient. When you first enter the room, greet the patient. A communication tool that can be used is the AIDIT system. Acknowledge the patient. Be sure to make eye contact and smile. Introduce yourself to the patient and explain your role. Let them know the duration of cleaning. Give them an explanation about what you will be doing in the room, which is cleaning. When you've finished cleaning the room, say thank you and ask if there's anything you can do for them. Part 3. Remove waste. As you begin cleaning the room, always be alert for sharps and other potentially infectious materials. To prevent injuries from sharps during waste removal, never push down on the waste. Handle plastic bags from the top. Tie them by twisting the top into a single gooseneck knot. And carry tied bags away from your body when removing them from the room. First, remove all trash and biohazardous waste from the room in accordance with facility protocols. Next, check the sharps disposal container and change it if it's full according to the fill line indicator. Lastly, remove soiled linens from the room to prevent the spread of soil particles or pathogens. Don't shake linens. Roll used linens into a bundle and carry linens away from your body. Part 4. High dust. Using a microfiber cloth, static duster, or damp duster to avoid the dispersal of dust, high dust all horizontal surfaces and fixtures above shoulder height that are not directly over the patient. These may include the tops of doors, overhead lights, television, pictures, high shelves, ledges, and air vents and returns. Part 5. Clean and disinfect. Cleaning and disinfecting patient rooms is a 6x6 process. There are 6 key cleaning tasks to do across 6 zones of the room. The 6 cleaning tasks are: inspect surfaces, remove soil, Apply disinfectant. Wait for the contact time. Discard wipes and polish to remove residue. And the 6 zones are the clinical zone, the common zone, the patient zone, the bathroom sink zone, the bathroom shower zone, and the bathroom toilet zone.
First, let's understand the cleaning tasks.
First, inspect all surfaces for visible soil or bioburden. If needed, ask the patient or visitors if you can move their personal items so that you can clean and disinfect these surfaces. Next, remove visible soil or bioburden by cleaning the surface. Apply a hospital-grade, EPA-registered disinfectant to the surfaces and items in the room. Always clean in a methodical way to avoid cross-contamination and ensure coverage of all surfaces. Things to remember are: clean in one direction around the room, either clockwise or counterclockwise, so nothing is missed. Clean from high to low to ensure that any dust or dust dislodged is removed when you clean lower surfaces. Clean from clean areas to dirty areas. The bathroom is always last. When cleaning a surface, clean from back to front, or furthest away to closest. This is particularly important when using bleach to avoid bleaching of scrubs, but also to avoid cross-contamination with contaminated scrubs or clothing. If using reusable cloths or disposable wipes, apply the disinfectant using an S pattern, overlapping slightly on each sweep of the surface. Do not go over the same area twice with the same wipe or cloth to avoid cross-contamination. If using a bucket system, never double-dip cleaning cloths into disinfectant solution. Wait to ensure surfaces remain wet for the contact time listed on the disinfectant product label. When you have finished wiping the surfaces, if the wipe becomes soiled, when the wipe is no longer wet enough to meet the contact time, or when moving between cleaning zones, discard the wipe. If using reusable microfiber cloths, use a new, clean cloth in these situations and place the soiled cloth in a hamper. Establish a polish to protect routine for occasionally wiping surfaces with a clean, dry, or damp cloth to prevent residue buildup and protect surfaces.
You'll apply each of these 6 cleaning tasks to each of the 6 room zones. The zone approach is a guide to help you clean from the least contaminated part of the room to the most contaminated part of the room to reduce the risk of cross-contamination while cleaning.
In each zone, you'll clean and disinfect all touchable surfaces, especially those that are closest to the patient. Always clean according to your facility's protocol, as some facilities assign cleaning responsibilities of patient care equipment to other departments or teams. Start in Zone 1, the clinical zone. Clean and disinfect the sink, hand hygiene dispensers, counter and cabinet handles, often touched by clinical staff. In Zone 2, the common zone, clean and disinfect doorknobs, light switches, furniture such as visitor chairs, couches, and tables, the computer or workstation on wheels, and the inside and outside of waste bins. In Zone 3, the patient zone, clean and disinfect all surfaces, including the side table and overbed table, TV remote, phone, nurse call button, and the bed, including bed rails, bed control panel, headboard, and foot of the bed. Spot clean walls and doors as needed. Never try to move a patient or attempt to change bed linens if the patient is in the bed. If the patient asks you to do so, tell them you will call a nurse to help them. Do not clean electronic medical equipment or devices that are being used on the patient, such as IV pumps, vital sign machines, or ventilators. The clinical staff is responsible for cleaning medical equipment when it's in use. After you've cleaned zones 1 through 3 in the patient room, you're ready to clean the bathroom. A small caddy can be used to carry the bathroom cleaning supplies you'll need, including a toilet bowl mop, cloths, and a toilet bowl cleaner. Start in Zone 4, the bathroom sink zone. Clean and disinfect the mirror, soap and paper towel dispensers, counter, faucet and fixtures, sink, light switch, and door handle. In Zone 5, the bathroom shower zone, clean and disinfect the shower fixtures, grab bars, shower walls, and floor. In Zone 6, the bathroom toilet zone, clean and disinfect the pull cord, grab bars, handles, and toilet paper dispenser. The toilet is the dirtiest, so should always be cleaned last to avoid cross-contamination. Clean the flush handle, external toilet surfaces, and toilet seat. Then, clean and disinfect the toilet bowl and under the rim. Wait for the disinfectant contact time and use a toilet mop to clean the inside surfaces of the toilet. Do not use the toilet mop on the seat or external surfaces of the toilet. Follow facility protocol for managing the toilet mop after use. Then, disinfect the bathroom caddy, remove PPE, perform hand hygiene, and replace the caddy on the EVS cart. Check whether you need to restock any consumable bathroom supplies, including toilet paper, paper towels, and hand hygiene products. Part 6. Restock the patient room. Next, replace the liners in all waste receptacles and the linen hamper. Restock paper products, cleaning products, PPE, and hand hygiene products. Part 7. Clean the floor. Put on PPE. Dust mop the traffic areas of the floor working towards the door. Dust mop the bathroom last. Make sure the wet floor sign is at the room entrance. Then begin mopping. Using a microfiber mop dampened with the facility-approved floor product, mop your way out of the room, starting in the back and working towards the door. Be sure to clean all traffic areas of the floor in a figure-8 motion. Mop the bathroom last. Change your mopping solution per facility protocol. If this is an isolation room, wipe down the wet floor sign, handles, and poles for mops, dusters, and other items with a disinfectant before returning items to the EVS cart. Part 8. Prepare to exit. Visually inspect the room before leaving. Let the patient know that you have finished cleaning. Ask them if there's anything else that you can do for them and say thank you before leaving. Remove PPE and perform hand hygiene. After leaving the room, notify your supervisor of any service or repairs needed in the room.
To recap, there are 8 parts to cleaning an occupied patient room.
1. Prepare to enter. 2. Engage the patient. 3. Remove waste. 4. High dust. 5. Clean and disinfect. 6. Restock the patient room. 7. Clean the floor. And 8. Prepare to exit. Visit cloroxhealthcare.com for complimentary tools and resources for cleaning patient rooms.